Why is there still stigma around maternal mental health? Why is it so difficult for us to have open conversations about this?
I think there's a number of reasons, really. I think one is that mental health is difficult to talk about. Like, if you think about, I guess, the emotional turmoil that people are going through, those things are not easy to sort of open your mouth and say, this is what I'm going through. And I think even though, think that mental health is on the agenda a lot more and it's talked about a lot more, but I think it really also very much depends on kind of like what sort of community you grow up in, what sort of family network you grow up in. And sometimes, maybe people of our generation, a bit more open about talking about mental health, but maybe our parents aren't so much. And so it's also, I guess, what you've seen growing up. What have you observed? And if talking about emotions, not even necessarily having a mental health condition, but talking about emotions, talking about how you're feeling isn't something that you see, in a way you kind of are getting the message that maybe when you feel like that you keep quiet or you keep silent. So I think that's one thing. And I think the thing is that a lot of people also don't understand different mental health conditions that a person might have.
In my family, the ladies are, stop crying, get on with it. Crying's not going to do anything, just deal with it. So I didn't really feel like I could say anything. In Nigerian culture, we have a thing where, your mum or mother-in-law, if your mum's not able to, will come over for, 6 months or whatever and stay with you and live with you. But my mum's like 10 minutes down the road, but, she came over, and I think for my husband, that was kind of difficult. Like,
That's an adjustment.
It was an adjustment. And they sort of started butting heads a little bit. So that was very stressful for me. I'm trying to please everyone. And at the same time, I'm like, I need to try and figure this out. So it was just a lot. And then I find myself very teary. And it was actually my dad that was like, okay, something's not right. You're not okay. You need to be very careful. And he was the one that said, you need to be very careful because after pregnancy, there's all of this stuff that happens.
So would it have been useful earlier on in your meetings during the pregnancy process for someone to talk through and say, this is what you could be feeling. These are some of the things that you could look out for. These are symptoms to look out for.
I think that would have been really helpful. Like, I felt really prepared for my pregnancy. So I was part of an NCT group and they taught us these breathing exercises. So when I went into my delivery, I was like, I'm not going to need any drugs or anything. I'm going to do this, and I did it, and it was like it worked the way they said it was going to work. So I felt super prepared for that. My husband came to all of those with me, and if there'd been a section in there about this is the stuff that you could feel, this is some of the mental health challenges that you could go through. I think not just for me but for him as well, because he struggled to understand what I was going through, and I couldn't articulate clearly what it was that I was going through either for him. Key. So I think having that would have been whether that's
your husband, your support network.
Yeah, whoever it is that you have with you, but just someone that can come so that you see it, but they see it as well. That, okay, this is something we probably need to look out for, and just, if we identify that or if you see that, then, we can go off and ask for some help.
If you're feeling overwhelmed or unable to cope, text Baby Buddy, all as one word, to 85258 for free anonymous text support at any time.